Hi guys, Chris here from Better Exercise Physiology. In this video, I just wanted to show you what I go through when I'm assessing someone's posture, and then what you can go through at home to have a look at your own posture. Now, particularly when we're having a look at your spine and the posture of your spine, which most people have issues, the best way to look at is from side on. What you can do to assess your own posture is just get someone to take a photo of you from side on, and then what you can do on the photo is just line up all the different points I go through. So we want our head over our shoulders, over our hips, over our ankles. The key points to look for are your earlobe. We want to make sure your earlobe is over the middle of your shoulder, which is over the middle of your hip joint. You've got a bony part in the middle, but basically it's at the middle of your thigh. That goes slightly forwards of the knee joint and then through the middle of your ankle. So that bony part at your ankle. Again, starting at your earlobe, we go down through the middle of the shoulder or just slightly forwards, the middle of your hip joint, slightly forwards of the knee, and then the middle of your ankle. We want all of them to be lining up. That way your spine is taking the least load and is in the strongest position. A few other things to look at. Your neck position. We want just a very small curve through the neck. We want to make sure that your head doesn't sit too far forward and we're not arched through there. Often people will find when their shoulders are rounded and their head sits forward, that earlobe actually lines up with your shoulder, but if we then come down to your hip, they're completely forwards. So we want to make sure the shoulders are slightly back without having to really pinch them back. They just sit back nicely. The neck is in a neutral position, so you're really long through the neck, and the chest is upright. A lot of people, particularly as they get older, they tend to be excessively rounded through the upper back. That naturally brings the head forwards, that naturally brings the shoulder forwards. So we want to make sure that's nice and tall through the upper back. Shoulders slightly back, head sits back. The next position I want to talk about is across your pelvis. With our pelvis, our front hip bone and the back, there's two bony parts at the front and back, should line up. What you can do, move around at the front to find the most pointy part there. Move around at the back to find the pointiest part at the back of the hip bones. Have a finger and thumb on them. Again, get someone to take a photo. And then in that photo, line up forwards and back. Now, if your forwards is tilting down, that's coming from tightness through your lower back, tightness through the front of the pelvis. If on the other hand, we're excessively flat through the lower back, that normally is coming from your glutes holding on really tight. Either way, your spine isn't going to be in a stronger position to support that. The last thing is around your ankle joint. It's a little bit hard to show in a test, but what you do is keep your heel on the ground and see how far you can come forwards at the knee. If you're tight through your ankle joint, what's going to happen is it's going to pull your entire body forwards and your lower back is going to be arched to compensate. So if you're tight around the ankles, you want to stretch that out as well. So those are the main things I'm looking for when we have a look at your posture. Now there's lots of other things we can look at, the position of your knees, the position of your feet, whether you've got any scoliosis. But again, those were the main things we went through today and the most important for the health of your spine. Hope that was useful. If you've got any questions, make sure you leave a comment below and head over to our website for all of our videos. It's at betterexercise.com.au. Thanks a lot.